Have you ever wondered how a surgeon in Tokyo can read notes from a doctor in Toronto and know exactly what's going on? It's because they share a secret language. And today, we're going to decode that universal language of anatomy, the incredibly precise vocabulary that lets us describe every part and every movement of the human body with absolutely zero confusion.
So, how do we actually do it? How can we talk about exactly where a pain is or what direction a joint is moving in a way that anyone, anywhere in the world can understand? I mean, this is so important. It's the difference between a successful surgery and a huge mistake, or between an effective workout and a serious injury. That precision, it's everything.
Now, instead of thinking of this as a bunch of complicated jargon, I want you to think of it like a secret code. And once you crack it, you unlock a completely new way of understanding the incredible machine that we all live in. It's pretty cool.
To learn this code, we're going to build our understanding from the ground up. We have to start with the absolute basics, the fundamental map that scientists and doctors use to divide the body into sections we can all agree on. This map of ours is defined by three, invisible planes. Just imagine three perfectly flat panes of glass passing right through the body. Each one creates a really specific kind of slice or view. We call these the anatomical planes. Okay, first up is the sagittal plane. Imagine a vertical slice, like a sheet of glass, that divides the body into left and right portions. Now, any slice like that is sagittal, but if that slice goes perfectly down the center, creating two symmetrical mirror image halves, that's a special one. We call that a mid-sagittal plane.
Next, we've got the frontal plane, which is sometimes called the coronal plane. This is also a vertical cut, but this time it splits the body into a front half, or anterior, and a back half, or posterior. It's like if you were standing sideways and that pane of glass separated your face from the back of your head. And our third and final plane is the transverse plane, or, you guessed it, the horizontal plane. Just like the name says, this is a horizontal slice that divides the body into a top part, which we call superior, and a bottom part, the inferior part. Think of it just like a magician's box, creating a perfect cross-section. So let's just lock this in real quick. The sagittal plane gives us left and right. The frontal plane gives us front and back. And the transverse plane gives us top and bottom. Easy, right? These three planes create the fundamental map of the human body. All right, so we've got our map, but a map isn't much good without directions. That's where our anatomical GPS comes in. It's a set of terms designed to help us navigate the landscape of the body with total precision. Now, the real key to this GPS system, the thing that makes it easy, is that the terms almost always come in opposing pairs. If you understand one, you automatically understand its opposite. Let's run through a few of the most important ones. Our first pair is superior and inferior. Superior simply means above or toward the head. Inferior means below or toward the feet. So, for example, your head is superior to your chest, and that, of course, means your chest is inferior to your head. See? Simple. Next up, medial and lateral. This pair is all about the body's midline, that imaginary line running right down your center. Medial means closer to that line, while lateral means farther away from it. So your nose, for instance, is medial to your ears, and your arms, they're lateral to your torso. Now, this last pair is super useful, but it's specifically for talking about our limbs. Proximal means closer to where the limb attaches to the body, and distal means farther away from that attachment point. For example, your shoulder is proximal to your elbow, while your fingers are distal to your wrist. Okay, we've got our map, we have our GPS, we can describe any position on the body with confidence. So now let's get things moving. Let's learn the language of action. First up for movements, we've got abduction and adduction. Abduction is when you move a limb away from the body's midline, like when you raise your arm out to the side. Adduction is the opposite, and here's a great way to remember it. For adduction, you are adding the limb back toward your body. Next, let's talk about flexion and extension. Flexion is what happens when you decrease the angle between two body parts. Think about bending your elbow to do a bicep curl. Extension is the opposite. You're increasing the angle, like when you straighten your arm back out. And finally, there's rotation. This one's pretty straightforward. It describes turning a body part around its own long axis. The classic example? Just shaking your head no. That's rotation of your neck. All right,
We've defined our map, we've learned our directions, and we've described our movements. We now have a complete foundational vocabulary for talking about the human body. So let's see how it all fits together.
So, what did we cover? We started with the 3 planes, sagittal, frontal, and transverse, which create our body's map. Then we layered on our anatomical GPS with those directional pairs like superior, medial, and proximal. And finally, we brought it all to life with the language of movement, using actions like abduction, flexion, and rotation. And just like that, you now have the fundamental tools. You have the vocabulary to describe where things are, where they are in relation to each other, and exactly how they move, and you can do it all with clarity and confidence. So I'll leave you with this question. Now that you speak the language, how does it change the way you see the world around you? The next time you watch an athlete play, or even just watch people walking down the street, what new details will you notice? The body's no longer just a shape in motion. It's a whole series of precise, describable actions. Pretty cool to think about, isn't it?